Welcome again. Today, let us look what is the right direction. When you are erect, where should your penis face? Most of you are saying mine is straight and it is the normal one. Are you sure? Some are saying mine is facing upwards, mine is facing downwards. And let us see today what is the right direction that a penis should face in when it is completely erect. First of all, what determines the direction? One, when during development, there are what we call ligaments, blood vessels, muscles that are growing in every part of the body. That's why you find people with dimples, the one you call dimples, but it might be an abnormality according to science. So muscles will develop differently in different people. What determines the direction we are supposed to be having? One, we are talking about tendons connecting to a muscle, maybe to a bone. How are your muscles connected to the bones? We are talking about ligaments. How are those bones coordinated? How are they connected? The muscle development, the ligament development, and others, and the muscular development themselves. The vessels which are there are the ones which are going to determine when you erect where you are supposed to face. So, most of the times, when you find that your erection is changing direction according to what you have in your brain, don't panic to say this is wrong. However, those ones who are saying mine is okay could be the ones who are having the wrong direction of erection. Now, let us take you through. Now, one, when you're erecting straight, it simply means there is normal alignment of the muscles, the ligaments, the tendons, the fascias, and others. If those things are aligned in a straight form, that is okay, and we consider that a normal erection, the erection, and has no problem to do with your erection. I'm sure this would be very well when you're having your sexual activity, and I'm sure it is not affecting the way you're doing your sexual activity and other normal activities. So we say this is okay and it has no problem. Two, someone could be having something facing slightly upwards towards the belly bottom. Now, it means that there is curvature within these ligaments during development. Some of them actually you develop them when you are a young child and they are putting you in pampers and tight pants, and others most of you are developing it with the time because you put on very tight things. So when you develop this and you have this and it is not affecting your sexual performance or activities, we say it is still okay. It has no problem. This one is okay. We have no problem as long as it doesn't interfere with your sexual activities. There is a way it can even go higher and it starts facing too much upwards. Too much upwards. That could be abnormal. So when it is slightly facing upwards, we say it is okay. Now there is someone who is saying mine faces slightly downwards, not too much downwards, as if it is not erect. Slightly downwards, we say that one is also okay. And the development course is also the same. Someone is saying mine is curved a little towards the left. We say that one is still okay as long as it doesn't interfere with your normal activities and sexual performances. Towards the right, it's also okay. Now, there's someone who will be having it when it is more curved to the right, or more curved to the left, or more curved downwards, or more curved, and it is interfering with the way they are performing their activities. Maybe to have sex, they have to stand this side and they start doing like this. We say that one might not be okay, and you might be having what we call Peyronie's disease, and you need to see a doctor. Unless otherwise, the rest of the things are okay. See you in our next video when we are interpreting more of the medical facts about men and other influences. I remain your doctor. See you.